Hello, Professor Lawrence. I'm HDeCaro, and these are my audience members, my husband Dave, and my daughter Shay. That's all I could get right now. I guess I will begin. You guys can sit down. You don't need to stand in front of me. Okay. Imagine your loved one, a woman in your life that you really care about, that suffers from something you can't understand if you don't have it yourself. Your mother, your sister, your wife. It's something that I personally suffer from, and it's called PCOS. PCOS is actually polycystic ovarian syndrome. It's not really a disease, but it's a condition that affects you hormonally. It affects you metabolically, and it also can affect you with infertility. It does not discriminate. It affects 1 in 10 women across the world, and between the ages of 15 and 44, which are your childbearing years. I keep saying it does not discriminate against race. However, there was a study in 2015 at the University of Utah that discovered that there's a gene carried mostly in Caucasian women that gives them a greater risk of having this particular condition. There was a doctor by the name of Corinne Welt. She is an endocrinologist with University of Utah Healthcare, who found the particular genetic connection between people of European descent carrying more prone to get PCOS. It changes your life as far as, women growing hair in places that they normally wouldn't, that men would normally go, their face, for one, their neck, their back, their chest. Also, it can cause male pattern baldness in women, which I can imagine being an extremely emotional thing. Thankfully, I haven't lost any of my hair. It also affects your ability to lose weight. It also makes you gain weight at the same time. Another factor of it is infertility. Because PCOS is actually cysts on your ovaries, it prohibits proper ovulation, and it also can alter how you menstruate. So no matter how hard you try, if your periods are irregular, you don't ovulate properly, it's very, very difficult, sometimes impossible, to get pregnant. Most people diagnosed with PCOS are diagnosed in their 20s and 30s because of the fact that they are trying to have children and they don't understand why, so they see their obstetrician gynecologist to find the reason, and the cause of it is usually PCOS. Another thing that happens with it as well is that it can cause miscarriages before the 24th week of pregnancy. I personally have had 2 miscarriages. I luckily was able to have 2 children. My first was at the age of 21, and it was an earlier week 1. I was 7 weeks, and so it was something more typical at such a young age. I was able to have a full-term boy a few years later, and then after 2 years of actually trying for us to get pregnant again, we finally were successful, and in about the 14th week of pregnancy, we found out that our child was not viable. So years later, it was pretty much told by my doctor to me that that was probably the likely cause of it. That was the hardest one. After that miscarriage, luckily, it was only a few more months later, I was able to conceive my daughter, And I had a lot of complications during my pregnancy, and she was born at 35 weeks. Luckily, very healthy. Obviously, you just saw her, so she's still here. Personally, as someone that knows how it feels to have this particular disease or condition, I've learned through a lot of my own personal research that diet management could be part of it. I talked to my doctor. I was diagnosed probably around 40 years old when we were trying consistently for about 8 years to get pregnant again, and nothing was happening. After that, she had told me that because I have cystic ovaries, that my ovulation patterns are just not happening at all. My periods are highly irregular. I never know when it's happening, and it's actually forced me into perimenopause at the age of 43. So any more children are out of the question for me. Actually, at this age, I'm not really concerned. But she had told me through diet, because most women that have PCOS are insulin resistant. So metformin is the actual medication that's used more prominently through helping to ease the symptoms. Also, she had said to avoid anything white, which would be your potatoes, pasta, rice, sugar, also dairy products, which is unfortunate because I love cheese and ice cream. And I also carry something called Hashimoto's thyroiditis, which is also something that comes along with PCOS that I was unaware of when I was diagnosed with it. And what that is an autoimmune condition that causes my body to think my thyroid is a foreign body, and it kills it, which affects me metabolically and hormonally, which affects my ovaries and all of my reproductive organs, as well as my entire body as far as weight, emotion. PCOS, along with Hashimoto's, causes severe anxiety. It causes depression because of the inability to properly regulate yourself hormonally. There really is no PCOS cure. It's only you're able to regulate it. It's an extremely difficult thing to live with, a very painful thing to live with at times. I have issues of usually severe pain in my ovulation cycle right before I'm supposed to be getting my normal cycle. So it's kind of a hint for me that it's coming. I found that I can live with it. It's difficult, but I'm hoping that with more research that doctors can find ways to better manage it and help women even younger than me who are unable to have children at the time, help them be successful in having children someday. Thank you.